Hi, this is my week 10 video journal. Some goals I set for myself at the beginning of the semester were to become more familiar with medication management, especially when we were dealing with patients on multiple psychotropic medications. Some feelings, prejudice, bias that I experienced during the clinical experience. Yes, I discussed this in one of my earlier videos. Patients with borderline personality disorder, which I've seen quite a few of them. They are obviously particularly hard to treat and can sometimes bring up some biased feelings. But I just try to stay aware of them and try to treat the patient appropriately as possible, be sympathetic to their needs, and try to restrain myself from any sort of judgment or guidance that could be taken the wrong way. How did I manage my anxiety, self-doubt, or uncertainty? Being a nurse, most nurses are used to just kind of being thrown into situations like sink or swim situations. So at this point in my career, I've kind of learned how to manage this sort of anxiety and self-doubt. I've also learned that just sitting and listening, like if you ever have some self-doubt or uncertainty on what to say, what to do, you can always just listen more, because these mental health patients often, can benefit from just having somebody to talk to. And so if you're not really sure on what to say or what to do, you can always just listen and kind of look into your resources. I was always checking like UpToDate or Stalls and trying to come up with appropriate evidence-based treatment plan. What understanding or insights did I develop during my clinical experience? The one thing I've been that has surprised me is the amount of people with past trauma in their life, especially like childhood trauma. So that's definitely something that's been insightful. And I'm trying my best to understand more about the effects of childhood trauma and how to go about treating them appropriately and getting them set up with the correct resources and specialists that they need. Obviously, it depends on their diagnosis and how they're managing. And then, has reflective practice impacted me as a person? Yes, I think nurses in general always try to use reflective practice. That's probably one of our strong suits, being nurse practitioners. We're always looking back and thinking like, what could we have done better? Did we do anything wrong? And sometimes it's a little daunting, because you leave the day and you're worried about what you did, and constantly thinking about that. But overall, it's just trying to evolve as a practitioner and always trying to be able to offer your patient the best care. Constantly researching and looking up evidence-based practices is super helpful with that. But yes, reflective practice has of course been helpful, and I will continue to do that. Also staying in tune to like my mental health and making sure I do self-care activities and pace myself, and know that will not be able to help everybody, but you just try your best. And then, will I continue to use reflection? And yes, absolutely. You always need to use reflection, especially in mental health. You take on a lot of patients, and you have to learn not to take on all of their problems with you, and just try to address, as much as you can, with preserving your own mental health and making sure you're staying healthy enough to treat them effectively. Thank you.